I think you can guess, although I don't think the data estimates, but you could guess that a lot of that 700,000 would be those younger, healthier people who can't afford the premiums now because they're so expensive and made so expensive by guaranteed issue and community rating and those things. The Democrats, or the people who advocate universal health care, need those lives to reduce the costs for the people who are most difficult to insure. In other words, they can't break down the walls for the young and the healthy to go get an affordable health care policy, because they need them in their pool to subsidize the insurance for the others who are older, sicker, or chronically uninsurable. And they're very frank about that. They said we can't let them go because we need them, and that is to me a startling position for a state to prevent its citizens, keep its citizens from benefits that are so clearly good for them and so clearly good for the rest of the state, because they have a kind of an ideological view of how these policies and how these reforms should be enacted. I think it's a potent political issue. I really do. I mean, I think it's very good policy, but it speaks to people. That's, as Republicans, we have to speak to people about their concerns, what matters to them, and this matters to people. They are anxious about it. They know what health insurance costs, and if we can provide them an alternative, provide them a mechanism by which they can provide for their families and save a little money and make their lives better, then people will respond to it. That a lot of people are frustrated. I am frustrated. I know you are. We have elections in this country for a reason, to express that opinion. We have a huge election that's undergoing right now.
Well,
2009. Hey, last Tuesday night at 8:01, when the polls closed, the 2009 election cycle started. And I was so relieved that the 2008 election cycle was over and that 2009 had begun. We have a great opportunity to change leadership entrenched in 2009. We have a governor who's out of touch and unpopular because he's out of touch on the ballot in 2009. We have
Going to be kicked upstairs to become secretary.
wherever he's going, he's not going to go back to drum thwacket after next November. The entire assembly is up for election. We're down 8 seats in the assembly. We got a steep road to climb, but we have the issues on our side. We really do, and we have the energy, and we have the climate. You look at these numbers. There are polling numbers up and down the state that say people haven't been this dissatisfied since the early '90s when they kicked Jim Florio and the Democrats out. In record numbers. And the right track, wrong track. People say states on the right track, states on the wrong track. I think it's worse than it was when Jim Florio raised our taxes to $2.8 billion, whatever it was. So there's an undercurrent of dissatisfaction and frustration. We're going to go get good candidates, both at the gubernatorial level and at the assembly level. We have the issues like healthcare choice. I'm convinced that healthcare choice can be one of 2-3 issues that Republicans could run on. You mail somebody in Burlington County or Camden County, in the suburbs of Cape May County, and you tell them that their representative is standing between you and your children and coverage at CHOP, and you see how many votes you get, and they should be penalized. If you're not going to support common sense policy on the basis of ideology or worse, pure partisan pressures,
Ideology, nothing else.
you should be penalized at the ballot box, and that's what I'm focused on doing. We're in the minority down in Trenton. It's somewhat liberating at times, but it's frustrating more often than not. But I see our role as the minority to create the record, put the ideas out there, come up with the ideas, demand action on them. If you don't get them, then you tell people, hey, we had a better idea and they didn't do anything about it. Do you like the way the state's going now, or do you want to give us a chance? Here's what we would do if we had a chance. We think it makes sense, don't you? And I think we can make changes in this. I really think over the next 4 years, when the entire legislature's up and the governor's office is up, we can have a sea change, but we got to be ready to grab it. On my website, jweber.org, there's all my opinion pieces. I think some television interviews, that I've done, and if you go on there, you can pull off the op-eds I've published on the issue, and in whatever it was, 720 words, whatever they give you, you talk, try to lay out the problem, a little more succinct than I was this afternoon, sorry, but lay out the problem, talk about the solution, and talk about the effect the solution had. Those pieces were published even before. I guess we published one after we got the University of Minnesota study. We talk about clearing half of the uninsured without spending a taxpayer dime. And then we can go back and figure out a way to insure the chronically uninsured. Government, it's not like government has no role in this process. Government should be a safety net. I think most of the people in the state of New Jersey believe that. I think Republicans believe that. Government's there to help people who are hit hard times, or have a hard time helping themselves in some ways. But this is a way to do it without spending a taxpayer dime. Then you can focus on the real problem. eHealthinsurance.com.
Yes.
If you go to eHealthInsurance.com,
Yes.
you can do this for yourself. That's what I did to write my op-ed.
Yeah.
You can plug in your age, your location. I think they might ask if you smoke, and then you get a quote on a premium, and it'll tell you what companies will provide it, and all the co-pays and deductibles. Then you go compare it to what it would be in Iowa.
Yeah.
By the way, no state would benefit more in terms of their citizens getting covered than New Jersey. No state would benefit more in terms of people coming to them to get insured than Alabama. Go figure.
Why hurt our local insurers? Why not just abolish the state mandates to allow them to write the insurance policies that out-of-state companies can write?
Well, two comments to that. You're not necessarily hurting your local insurers because
They write outside state.
our insurers do write in multiple states. Now, the only insurer you got to deal with is Horizon Blue Cross Blue Shield, who is a New Jersey entity, and they can't. There's a Blue Cross Blue Shield in Pennsylvania and in every other state. So you have to deal with Horizon, and I think there's ways to deal with Horizon within the framework of the bill that won't hurt Horizon. By the way, Horizon might be able to set up shop outside and sell back into New Jersey anyway. And agents, when these new policies would need to be sold, there's no sense in hiring new agents. They can just use the agents who are already in New Jersey. Insurance agents in New Jersey have contacted me saying, please let us sell policies that are written in other states because our clients need it. People to make a choice, and that's the American way, is to let people have a choice in what they want to do, how they want to run their lives, how they want to spend their money. It's an ironclad law of economics. You raise the price, people buy less. And that's what they've been doing for years, is making insurance more and more expensive, and the individuals have bought it less, and small employers, you just can't buy it anymore for their employees. And small businessmen, it breaks their heart not to be able to insure the 10, 15 people who work for them. They'd love to be able to do it, they just can't afford to.
Get the Chamber of Commerce's and the Rotary Clubs.
Chamber of Commerce, Business and Industry Association, all those groups are looking at it. I would hope they'd jump on quicker, frankly. But we're working in a good coalition.
An 8.5 by 11 sheet. The buttons.
Yep.
So
South Jersey Chamber of Commerce, especially with CHOP. I can't express to you, I've spoken to my colleagues down in South Jersey, this CHOP issue is huge for those families down in South Jersey. And to prevent people from getting access to policies they desperately want. It's worse than bad policy, it's not right. It's like it's immoral.
Thank you very much.